A pregnant woman rushed to the hospital in Wa after a snake bit, denied emergency care and sent away without treatment at Pampasu Children's Hospital in the Ashanti region. Another expectant mother, 6 months pregnant and nursing severe burns from hot soup, limbs out after being turned away. These are just two among many disturbing stories emerging from across the nationwide strike by the Ghana Registered Nurses and Midwives Association. Patients battling pain and uncertainty are forced to travel long distances only to be rejected at the hospital gates. Let's get you around the country and bring you update on what's happening. I will start from the Upper West region where Rafiq Salam joins. Rafiq, what's the situation in the Upper West region as of now?
The situation in the Upper West region is not different from what we are hearing from the other parts of the country. This morning, I went to the Upper West Region Hospital. Just at the gate of the hospital, I bumped into a highly pregnant woman, 22 years of age, 9 months old pregnancy, where she told us that she suspected that she may have been bitten by a snake when she went to attend nature's call at her community at Konfabiela, which is about 6 kilometers away from the hospital. And so the husband took her on a motorbike and they came straight to the Upper West Region Hospital, where they first went to the OPD department of the hospital, and then also from they didn't get the needed help that they wanted, the care that they wanted. From there, they moved to the emergency and also to the antenatal. We were also told that the woman was supposed to go for scanning today at the hospital, and this unfortunate incident happened. And so, this department that she went to at the hospital, she was not given the needed care. And so, she and the husband decided to go home. So, I asked the husband what happened next. And the husband told me that maybe probably he doesn't wish that, but maybe the woman was destined to die because they have no other alternative to go than to. The only alternative that they have is to take the lady to the herbalist for them to see whether they could be able to get some kind of care from them. It is not only the sort of warrior that we bump into. There was another woman who also came to weigh the baby, but they also were not also attended to. She was asked to come in a week's time because the GRNMA strike is on. You know, this strike is really batting hard in the Upper West Region, especially the one municipality, the one municipal hospital, and also the Upper West Regional Hospital. But you know, it is not only apart from the GRNMA members who are on strike, we have one of their sub-bodies called Union of Professional Nurses and Midwives Ghana, UPNNA, who are saying that yes, though they agreed with the strike, but they are not happy with the way that their leadership is going on about it. And so they are also going around. Some of their union members are at post at the Upper West Regional Hospital and also at the Wa Municipal Hospital. So when you go to these two facilities are in the Upper West Region, you see members of the UPNMA who are really at post. We also managed to speak to authorities at the hospital. We spoke to some doctors, and they told us that now, because of the strike, their work at the facility, if not triple, but it's doubled, because some of them are now, apart from doing consultation, they are now the people doing the medication, they are not the people do a whole lot of things at the hospital. And so for them, the strike is really having a lot of impact on them, and they are called on the GRNMA and also the government to come to the negotiating table to at least to alleviate the pain that they have currently.
Okay, Rafiq, quickly, so the woman who has been bitten by a snake, do you have any current updates? It's been hours since. Do you have any current update?
When we got to the emergency service, work at the hospital was going on because we spotted some members of the UPNMA and also some nurses trainees. We were told that they were at home. So we called back the woman on the phone as we speak now, the woman is back to the hospital, and I'm not quite sure whether they have attended to her yet, but we're told that at least they have some kind of skeleton staff at some of these facilities, and then they will be okay. So we made a call. But one thing interesting that happened took place at the War Municipal Hospital, where we bumped into members of the UP, NMJ, and also the GRNMA in a near fisticuff about the strike. You know, we have the GRNMA there. We go around, according to them, educating the people, sensitizing the people to see their plight, and also to ask them to go home. But the UP, NMG wouldn't take, heed of that. There was a near altercation between them, and then also that was what happened at the World Municipal Hospital. But we spoke to the administrator of the hospital, and he told us that things are going on well at the hospital.
Rafiq, thank you so much for that detailed and very extensive reports from the Upper West region. And of course, we really wish that woman with a snake bite some good health. But not every nurse is on strike. Let's speak to John Agbenyevu of the Union of Professional Nurses and Midwives. Thank you for joining us. For joining us. Let me get the name correct. John Agbenyevu. I hope I got it right. But thank you for joining us this afternoon. Right. So, not all the nurses are on strike.
Yes, thank you very much, and good afternoon to viewers and listeners. So, the Union of Professional Nurses and Midwives, being a union that is meant for the welfare of nurses and midwives and also for Ghanaians, we understand that we do not have to embark on this strike for reasons that we have spelled out in our communique that we have released, but I'll make them known. Yes, we understand that there's a need for the condition of service to be implemented, and that we are fully for that. But we believe also that there are other ways we can get this done without putting the life of Ghanaians on the line. And so we believe that dialogue can be able to help us do some of these things. And so we said that this strike is uncalled for, and the processes leading to the calling of the strike, as declared by illegal by the National Labour Commission, was not done properly. And so our members should stay at post and help Ghanaian patients that will arrive at those facilities. We understand that this may not be able to solve all the problems, but we know that we can be able to put in the little effort that we can put in to ensure that those that will be able to meet will be able to help them.
And so for the Union of Professional Nurses and Midwives, you are at post and you're working fine.
Yes, our members are at post and they are working. In fact, we have actually visited some facilities and we have found our members, they're working. Some facilities are intimidating our members and we are calling on them to stop because we do not belong to the union that actually called the strike. And so if we have members who want to come to work, let's allow them to do that. The intimidation tactics will not work. And so we may go further to put in some measures to reduce some of these intimidations, and we have done that since yesterday up to today.
So so between yesterday and today, what's some of these measures? And I ask because some days ago, the government promised that for nurses who are willing to work, they're going to be providing security for them. Have you since engaged the government on that security that was promised?
Yes. So as we speak, we, as mentioned by your reporter Rafiq Salam, some of these issues are just pockets of issues that are happening, and we have actually picked that intelligence. So we have made some calls to do relevant stakeholders to get some of these things dealt with. And we've also assured our members about the fact that those who may face some of these challenges, we have put out some numbers for them to call. And so we have received a few calls from members who have some challenges, and we have stepped in to resolve it for them. So by and large, we have members who are working in almost all facilities in Ghana. Like I mentioned, the numbers may not be enough to commensurate with the number of patients that are coming, because obviously once a certain number of people are going out, it will affect the numbers. But then we are trying our best to ensure that we provide the little that we can.
And of course, that's something. And thank you for joining us this afternoon on Join News Today. Now.